Assalamu alaikum. Our today's topic is prenatal diagnosis, and we will focus on ultrasound, chorionic villus sampling, amniocentesis, chordocentesis, and Down syndrome. But what is prenatal diagnosis? It is the identification of a disease in the fetus prior to birth. And it is usually done when there is a strong history of genetic diseases or there is a past obstetric history of rhesus immunization, or if you want to rule out the trisomy 21, that is Down syndrome, and ultrasound screening at the 12 weeks dating scan or a 20-week anomaly scan. But how can we diagnose these genetic conditions or chromosomal abnormalities? Well, there are two kinds of tests. The first one is the screening test, and the second one is the diagnostic test. Let's focus on screening tests first. It includes alpha fetoprotein. It is increased in the neural tube defects, B-HCG. It is increased in the Down syndrome and hydrated mole. Rhesus immunization is also checked as a screening test. There is also a screening test known as cell-free fetal DNA. In this, a sample is taken from the maternal blood to check the fetal blood group. It is usually done at 10 weeks, and it is done for the purpose of fetal sex determination and screening for the trisomy 21, 18, and 13. The next screening test is BSR. It is done for gestational diabetes, and urinary proteins are also checked in the screening test. When it comes to diagnostic testing, there are two types. One is the non-invasive and the other is invasive one. Non-invasive includes ultrasound and karyotyping from the maternal blood, while the invasive one includes chorionic villus sampling, CVS, amniocentesis, and chordocentesis. Let's focus on the non-invasive one, ultrasound. It includes the dating ultrasound, which is usually done at 11 to 14 weeks, and anomaly scan, which is done between 18 to 22 weeks. You can generally remember the anomaly scan is done at around 20 weeks. And what kind of anomalies are detected? It usually detects the neural tube defects, gastroschisis, malformation of the lungs, and twin-to-twin transfusion syndrome. What are the advantages of doing the ultrasound? Well, you can confirm the viability of the fetus, and you can accurately estimate the gestational age. You can determine the sex of the baby. You can check the liquor adequacy, fetal positioning, and blood supply. And if there are multiple gestations, you can also rule out the genetic or chromosomal abnormalities like Down syndrome. You can easily rule out the gross structural abnormalities, and it can be repeated every 3 to 4 weeks, and it has no risk of causing miscarriage. That's all about ultrasound. Let's move on to chorionic villus sampling, CVS. It is a procedure which takes a sample of the fetal trophoblastic cells from the developing placenta. CVS is linked to placenta, while amniocentesis is linked to amniotic fluid and chordocentesis is linked to placental cord. But how is the sample taken in this procedure? It's simply done by passing a needle under the ultrasound guidance through the abdominal wall and myometrium. We have to traverse through the myometrium as we can only reach the placenta after crossing the uterus. We can also do the CVS sampling by passing a fine catheter through the vagina into the cervix and ultimately take a sample from the placenta. It is usually done at 11 weeks and never before 10 weeks. One thing that you will find common in all these invasive techniques is that we will do a screening test first before doing the procedure. And we will check if the pregnancy is viable, if there is a single fetus, what is the gestational age of the fetus, as we can't do certain procedure at certain gestational ages. And to check the location of the placenta, the risk of a miscarriage with CVS increases to 2%. But if there is a 2% increased risk of miscarriage, why are we even doing CVS? Well, it is the diagnostic technique to confirm the common aneuploidies like trisomy 21, trisomy 18, and trisomy 13, and to check for the genetic disorders, cystic fibrosis, and thalassemia. To remember the purpose of CVS, here is a line. You are feeling down और आप अपनी सिस के साथ किसी रेस्टोरेंट में जाके खाना खा रहे हैं तो खाने को आप थाली से याद रख लें. तो feeling down, you go with your sis to a restaurant and you eat in a thali. Let's move to amniocentesis. It is done at 15 weeks and the miscarriage risk is 1%, 1.9% to be accurate. What is amniocentesis? It is a procedure in which a sample is taken from the amniotic fluid and it contains amniocytes and fibroblasts. Around 15 to 20 ml is taken. It is done in a similar way through ultrasound guided needle. It is passed through the abdominal wall and myometrium into the amniotic cavity and the fluid is aspirated. And initial screening ultrasound is performed prior to the procedure, just like we did in the CVS. It is used to confirm the diagnosis of common aneuploidies and genetic disorders, just like it is done in the CVS, but CVS was done at 11 weeks while amniocentesis is done at 15 weeks and onwards. Along with these two, it also detects a viral infection like CMV, cytomegalovirus. To remember why amniocentesis is done, here is a line. Amna was feeling down, so she went with her sis to a restaurant and she ate in a thali. Later, she took a picture with CM and it went viral. Amna is amniocentesis feeling down. She went with her cis cystic fibrosis to a restaurant to eat in a thali thalassemia and she took a picture with the CM cytomegalovirus CMV and it went viral, that is viral infection. And the last invasive process is chordocentesis. It is done around 20 weeks and onwards and the risk of the miscarriage is increased to 2 to 5%. It is done just like the previous methods. An ultrasound guided needle is passed through the abdominal wall and myometrium into the umbilical cord at a point where it inserts into the placenta. The umbilical cord is usually fixed at this point and it does not move freely. And chordocentesis is done when there is severe fetal anemia or thrombocytopenia. And not only you can diagnose the thrombocytopenia, but you can actively transfuse the blood into the fetus. And last but not the least, let's study about Down syndrome. It is the most common reason for performing the invasive prenatal diagnostic testing. In first trimester, to diagnose the Down syndrome, a combination test is done. An ultrasound scan and the maternal blood testing is done. Ultrasound is done at 11 to 14 weeks to measure the knuckle translucency and crown rump length. The knuckle translucency is increased in the Down syndrome babies, and maternal blood testing is also done around the same time, that is 10 to 14 weeks, to measure the beta HCG level and pregnancy associated plasma protein A, PAP-A. But let's suppose a mother did not approach you in her first trimester and she came to you in her second trimester and now you want to screen the Down syndrome. What should be the options? Well, now in the second trimester you can a quadruple test that includes beta HCG level, alpha fetoprotein level, unconjugated estriol and inhibin A level. When it comes to the counseling of such a mother with suspicion of Down syndrome, she should be encouraged to consider what actions she would take and how she would feel if she is screened positive. And it is just a simple screening test and not a diagnostic test. And a low risk does not rule out the possibility of Down syndrome completely. You should also discuss the diagnostic testing that is available. Further markers such as measuring the nasal bone and frontomaxillary nasal angle, presence of the tricuspid regurg and ductus venosus should be done. And she should be given the option of termination of pregnancy too. I have added the slides from the UWord notes and emboss notes. And I have only highlighted the points that are not mentioned in the 10 teachers and are unique only to these notes. You can take a look and check out the past papers later. That's all for today.